So what made you become a doctor?
Well, when I got out of high school, I was looking at majors for college, and I just felt like I wanted something challenging, which I thought doing pre-med and going to medical school would be very challenging. I was interested in science. I loved biology. I enjoyed chemistry. And I felt like it would be something valuable to do with my life. I'd be able to help other people, and it would be a fulfilling occupation.
Cool. What kind of education do you have to become a doctor?
Well, in general, you do 4 years of college. Most physicians have a college degree, although you can go to medical school without a college degree. You have to have certain college classes before you can apply to medical school. But generally 4 years of college followed by 4 years of medical school, and then you have residency. Depending on the type of specialist you're going to be, it determines how long your residency is. After you finish medical school, you have a doctor of medicine or osteopathic degree if you go to osteopathic school. Then you go into a residency. Your first year is your internship. Once you complete that, you can take your test to become licensed. And so after 1 year of residency, you can become a licensed physician. And most residencies are a minimum at least 3 years. So 4 years of college, 4 years of med school, and 3 years or more of residency.
Great. So as an ER doctor, when they bring someone in who's been in a terrible accident, what are some of the first things that you look for in a patient to kind of begin to figure out what's going on with them?
Well, first thing, basically, you look responsiveness. Is the patient awake and moving and talking? If they're not, then you have to determine if they have a pulse. Are they breathing? Which you basically do that kind of at the same time. And if they don't have a pulse, you start CPR, start compressions, and then you go through the advanced cardiac life support system to try to restore their pulse and restore their breathing.
Where are some places that you are good to check for a pulse? Like what's the most accurate places, or what do you go to?
Well, the most common place we check for pulse initially is going to be the carotid pulse, which is below the jaw. It's basically between the windpipe and the muscles of the neck. There's a kind of a groove right in there, and you just go below the jaw, and that's the first place you feel. That's generally the easiest and the one that you're gonna be able to feel even when their blood pressure's really low. But you can feel multiple other places. You can feel pulses all over your body. In small infants, sometimes we'll feel a brachial pulse, which is just on the elbow area, and you can feel a radial pulse if their blood pressure is high enough. We do a femoral pulse, which is down where the joint, the leg joins the pelvis, and you can feel pulses at the top of the foot and the back of the ankle.
What kind of information are you hoping to get when you're checking for a pulse? Like what are you looking for?
Probably the first thing is, well, is there a pulse? Because if there's not, then you have to take immediate action. Then you want to check what is the rate, how fast is the pulse, and is the pulse regular, is it irregular, is it skipping around, changing rate. You can also feel does their pulse vary when they breathe in or breathe out, can tell you some things. And of course, how strong is a pulse? Is it a good bounding pulse, or is it just a weak, thready pulse? So both things. If it's too weak, that could be a problem, or even if it's too bounding, then that could be a problem.
Cool. So what's the best part of your job?
The best part of my job in the emergency room is when people come in and they've got a significant problem, came on suddenly. they're in distress, and you can rapidly take some action that either relieves their pain or fixes the problem. I like to fix things, and so the conditions, for example, a nursemaid's elbow. A parent will bring a child in and they can't move their arm, they won't move their elbow, a little toddler, and you ask them how it happened. Usually you can tell by how it happened if it's a nursemaid's elbow, and you can just take their arm and you turn it a certain way and it pops the bone that's out of place, it pops it right back in, and the kid starts using his arm normal and is happy and playful within a few minutes, and you fixed it quickly. You don't have to do a bunch of expensive tests and x-rays, and the parents are just get immediate relief. Things like that are probably what I enjoy the most.